Children get cough and cold very frequently. However, sometimes they can get breathing difficulty. So breathlessness is a medical emergency. So if the children have these symptoms, the parents should bring them to see a doctor immediately for further assessment and treatment. So there are many causes for this breathing difficulty. Most of these breathing difficulties is due to an infection, and the most common infection is due to a virus infection of the respiratory tract, such as a cold and a sore throat. Symptoms is usually mild, and children will be expected to recover after a few days. However, sometimes this infection may cause something more severe, and they may require urgent treatment in the hospital, such as bronchiolitis and Khoo. The other common cause would be a bacterial infection of the respiratory tract, what we know as pneumonia. They may require a course of antibiotic to treat the infection. There's another cause which is asthma. So asthma can occur at any age group, and the symptoms may include breathlessness and wheezing, especially at night or after exercise. And severe asthma sometimes can also cause severe symptoms, which may require urgent treatment in the hospital as well. The next one is allergy. Children can be allergic to food or medication, and the symptoms may include clear nose discharge. They can have itchy body rash. Sometimes they can have swelling of the eyes or the tongue or the lips. So sometimes it can also cause swelling of the lower respiratory tract, and this can cause asthma-like symptoms such as wheezing. And again, this is an emergency, and they may require urgent treatment in the hospital. Last but not least, foreign body inhalation and injections, especially in the toddler age group, and blockage of the airway by small objects such as pieces of food, small toys part, sometimes small building blocks. All these can obstruct the airway and cause sudden severe breathing difficulty. And therefore, it is important for the parents to be familiar with the first aid management as well as a basic cardiac life support. So the common symptoms include that of first, fever. Sometimes they can have cough, runny nose. Sometimes they can have nose discharge. It can be clear in color, or it can be yellowish, greenish, or brownish in color. All these may indicate respiratory tract infection. The more severe symptoms include that of breathlessness as well as drowsiness and chest pain. There are many signs that may indicate breathlessness in children. First, breathing rate. An increase in the breathing rate may indicate breathing difficulty. So you count the number of breaths in 1 minute. For young infants between 0 to 6 months old, it is considered fast if the breathing rate is more than 60 breaths per minute. But for an older infant between 6 months to 1 year old, more than 50 breaths per minute will be considered fast. And for children between 1 to 5 years old, it's more than 40 breaths per minute. School-age children, more than 20 to 30 breaths per minute will be a fast breathing rate. Other signs also includes that of increased effort of breathing. This can be observed when the chest is sinking in below the neck or below the breastbone. You may also observe that the muscles between the ribs as if they are pulling in when the child is breathing. The third sign is flaring of the nostril. So this can be observed when the nostril is widened when the child is breathing in. This can be a sign of a child is trying to use more effort to breathe. And the next one would be grunting. Grunting is the noise that's produced when the child breathes out, a sign that to indicate that the child is trying to get more air into the lung. Next one, change in color. So sometimes the skin may appear pale, or the lips or the tongue may appear bluish in color. This may indicate that the oxygen level in the body is lowish. Drowsiness is also an important sign to look out for. So children may appear tired looking, they may have difficulty keeping themselves awake. This also can be due to a low oxygen content in the body. So you should consult a doctor if your child has the following symptoms. First, if the symptom is getting worse, or child is getting more breathless or getting more unwell. Second, if your child is coughing out blood. Third, if your child has difficulty in feeding or drinking because of breathlessness. And fourth, If your child was previously diagnosed with a lung condition such as asthma or any chronic lung disease. And last but not least, if your child has a pre-existing medical condition such as heart problem or any defect in immune system. So children and toddlers can develop symptoms pretty quickly and can deteriorate very, very fast. So it is important for the parents to keep a close eye on them, and if let's say there's any concern, you should bring them to see a doctor immediately for further consultation.